as a mother to a baby girl who has also experienced a significant medical emergency in a childcare center that failed to respond in the way that could have cost her life, I'm very passionate about this. And this is exactly why we have a massive initiative going on for childcare centers to adequately train their staff and caregivers on how to respond in three major areas. This includes choking prevention, poison prevention, and anaphylactic shock. That's when someone's experiencing an allergic reaction that requires medical intervention immediately. This massive initiative has been for childcare centers across the United States. And my biggest gripe about trainings that organizations invest in is that it lacks critical components that prevent people from learning, retaining, and reacting appropriately that can literally save someone's life. It's typically on demand, online, where people are clicking through just to get a completion or a certificate. And then 90% of the time, most trainings are not tailored to the learning needs of that specific audience, doesn't provide a resource that they can refer to and utilize over time, and doesn't provide life-saving resources that that center probably doesn't have in their arsenal. And that's what I'm talking about, a life vac. So if you are a staff, leadership, a parent, a caregiver of a child who attends a child care center, daycare center, Jewish community center, YMCA, fill in the gap. We are doing trainings, interactive workshops for child care center staff and caregivers to be trained in these three critical areas where we're seeing the highest incidence rate. I used to be the director of a poison center, and that really opened my eyes to the significant gaps in education and resources that are required to prevent and save lives in a variety of settings. The first thing that people say to me, especially non-medical professionals, is that, hey, Britt, our team and staff is already well equipped. We have our CPR certification and our first aid training already complete for the year. Okay. I've called hospitals, health departments, fire departments, police departments, and really asked them about what's included in their trainings. There are major gaps in those topics. Major gaps in those topics kind of makes sense because of the major health outcomes, incidence rates, death rates, fatalities, preventable instances that are involved in those three categories: poisonings, chokings, and allergic reactions. So we have to do better as leaders of organizations, as parents, as communities, to really advocate about the topics and the way that they're presented that helps people to learn, retain, and react appropriately in the event that something does happen.